Welcome to Have More Babies, the show that helps you dive deep into essential topics. We give you the facts and insights you need pretty fast. Today, we're tackling something really crucial for any parent, or if you're expecting, choosing the right primary care provider for your child. We've got some great source material here from Omega Pediatrics that really makes a strong case for one particular choice. Let's get into it. Okay, so let's unpack this a bit. When you think about your kid's primary care, there are a few options floating around, right? Like you could go with your family doctor, maybe a nurse practitioner. They see kids too. But the material we looked at really zooms in on pediatricians. It makes a really compelling argument for why that specialized focus is such a good idea for you and your child. Yeah, the sources jump right in, highlighting something pretty fundamental. Kids aren't just tiny adults. It sounds obvious, maybe. But their healthcare needs are genuinely unique. And that's where a pediatrician's specialized training really comes into play. So what's the big difference in how they're educated?
Well, it's actually quite fascinating, the path they take. It's really dedicated. So beyond the basic medical degree that all doctors get, they do 4 years of pre-med, then the 4 years of medical school itself, getting their MD or DO. But then, crucially, they complete 3 full, intensive years of residency training that is only about pediatrics.
3 years just focused on kids.
Exactly. Just babies, children, adolescents. And some, they even go on to do extra fellowships, in really specific areas like pediatric cancer or developmental issues, maybe heart problems in kids. It means they are just laser focused on child health. And you might see like FAP after their name.
What's that?
That means Fellow of the American Academy of Pediatrics. They've passed their specialty boards, is kind of the gold standard. Signifies real expertise.
Wow, okay. That's a serious level of focus. So translating that, what does all that specialized education actually mean for you, the parent, when you walk into that clinic?
Well, it means you're getting someone whose knowledge base is incredibly deep, specifically about children's health. They're not just generalists who also see kids. Their whole world is pediatric research, the latest treatments, how diseases present differently in small bodies versus adults.
Right.
They're constantly updating that knowledge, too, through, conferences, ongoing education. It ensures the care is really top-notch, really current.
Okay.
They understand the whole arc from newborn checks to adolescent mental health. It's comprehensive care for physical and mental well-being. And they know when to bring in other specialists, too.
So they're like the expert hub for your child's health. That makes sense. And, our sources talk about something else, too, beyond just the medical smarts. It's about the connection.
Yeah, totally. And this is so important, right? It's not just about knowing the science. Pediatricians are, they're generally really skilled at talking to kids. They learn how to build rapport with everyone, from tiny infants up to, sometimes skeptical teenagers.
Which can be tricky.
Oh, yeah. Doctor visits can be scary for kids. But pediatricians often have this real compassion. They know how to make the visit less intimidating, maybe even fun. Think about it. A kid who feels comfortable is more likely to actually tell you what's wrong or let you examine them properly. That trust is huge.
Oh, definitely. And that actually leads right into something else our source mentioned, which I found really interesting. It's the whole clinic environment itself.
The best ones really think about this.
It's not just a couple of sad toys in the corner, is it?
No, not at all. The source points to clinics designed with kids in mind. Bright colors, maybe cool themes, comfortable spaces, distractions like interactive toys, books, maybe even little play areas. It seems simple, but it genuinely lowers anxiety for kids and parents.
Right. The kid's calmer, you're calmer.
Exactly. And a relaxed child often means a better, more accurate checkup because they're not tense or scared. The pediatrician can get a clearer picture.
And it's not just the paint color, though. The source talks about specific services these clinics often provide, things designed for kids and, honestly, for busy parents. Like, what's the real advantage of having, say, in-clinic IV fluids available? Or doing medical ear piercings there?
Oh, that's a great point. Convenience for parents often means better, faster care for the child. So take those in-clinic IVs. If your child has a nasty stomach bug and gets really dehydrated, getting fluids right there in the office can sometimes avoid a whole trip to the ER.
Ah, okay. That's a big deal.
Huge deal. Saves time, stress, money. Same with respiratory monitoring. If your kid has asthma or maybe RSV, they can assess them right there, get real-time data.
Makes sense.
And things like ADHD screenings done in-house. That means earlier detection, quicker support for the child. Even the medical ear piercings doing it in a sterile medical setting minimizes infection risk. It's just smarter.
So it's really like a whole ecosystem built around the child's needs and making it easier for parents to access that specific care. It just flows better.
Precisely. It streamlines everything.
Okay, moving on. Our source really hammered home the long-term benefits of, sticking with the same pediatrician over time.
Ugh.
So beyond the immediate stuff, why is that continuity of care considered so important for a child's health journey?
Yeah, this is absolutely fundamental to good pediatric care. Pediatricians ideally follow a child's health and development right from birth, all the way through their teenage years, and often into young adulthood, like up to age 21 sometimes.
Wow, 21 years potentially.
Potentially, yeah.
Ah.
And that long relationship, it builds incredible trust, not just with the child, but with you, the parent, too. Regular visits with someone familiar just make the whole experience less stressful, more predictable for your child. They feel safer.
Okay, that makes sense emotionally. But what about the medical side of sticking with one doctor for that long?
Medically, it's incredibly valuable. That one pediatrician keeps a single, detailed, consistent health record over years, sometimes decades. This is just vital for spotting subtle patterns or ongoing issues, things that might get missed if you're bouncing between different providers who only see your child now and then.
Right, like connecting the dots over time.
Exactly. Maybe there's a history of certain allergies or a family tendency towards something. That long view helps them make more accurate diagnoses, tailor treatments. Our source connects this continuity directly to big goals like, reducing infant mortality, controlling infectious diseases through consistent vaccines, fostering healthy lifestyles, making life easier for kids with chronic conditions because their history is known, and just making sure development is on track. It's proactive.
That continuity sounds like a crucial safety net, and it seems to cover a really wide range of things too, not just like colds and ear infections.
Oh, absolutely. It's a truly holistic view. Pediatricians are trained to handle a huge spectrum. Yes, infections, injuries, even genetic conditions. But also, importantly, behavioral issues like ADHD, developmental delays in speech or motor skills, and increasingly mental health challenges like anxiety or depression in kids and teens.
So they're often the first stop for those concerns too.
Very often, yes. And because they know the child over time, they might notice gradual changes that signal something deeper is going on. The source material even points to studies showing fewer hospitalizations for kids who have that consistent primary care doc.
Yeah.
Yeah, because issues get caught and managed earlier before they blow up into something requiring a hospital visit. It's about knowing your child's baseline normal.
Okay, so the pediatrician is this amazing resource, this ally. But of course, as the parent, you're still the primary caregiver day to day. Our source laid out some key ways parents can really partner effectively with their pediatrician. What should parents be focusing on?
Well, one of the biggest things is just actively tracking and observing your child's development. You see them every day. Noting when they hit milestones or if they seem delayed gives the pediatrician invaluable information about their growth physically and mentally. Are they talking on time? Moving as expected?
Sharing those observations.
Exactly. And then fostering really open communication, talking honestly with the pediatrician, but also, importantly, encouraging your child as they get older to talk directly to the doctor, too.
Yeah,
It helps them take ownership of their health.
that's a great point, building that skill. What else?
Definitely don't skip immunizations. It's one of the most powerful preventative things you can do. Stick to the schedule your pediatrician provides.
Right.
And remember, pediatricians are also great guides. They know when something is outside their specific expertise and needs a referral to another specialist, like, say, an allergist or a child psychologist. They help you navigate that.
Okay. And then there was a final point, sort of bringing it back home, about the impact of just good parenting.
Yeah, the source really underscored this. The pediatrician is your health expert, but the home environment is fundamental. It talked about being kind, but also consistent with rules and boundaries, having regular routines for meals, sleep. That structure helps kids feel secure, engaging in real conversations, even with little ones, ensuring they feel safe and loved, and, correcting misbehavior reasonably, explaining why these aren't just nice ideas. They actively support emotional regulation, behavior, thinking skills, social skills. It all works together with the medical care.
It's a true partnership then, healthcare and home life.
Totally.
So wrapping this up, what's the big takeaway here for you as a parent facing this choice? It's clear that deciding on primary care is a really significant decision. And our look at the Omega Pediatrics material strongly suggests that choosing a pediatrician with all that specialized training, the kid-friendly approach, that focus on long-term care, it offers a really solid, comprehensive path for your child's health and well-being right from the start.
Absolutely. It really boils down to Finding a pediatrician you trust, someone who feels like a partner, someone who will work with you to track your child's growth, their development, their overall well-being at every stage. That collaboration is key.
And if you want more details on everything we've talked about, the benefits, the specific services like acute or preventive care, vaccine info, or if you want to book an appointment, we definitely recommend checking out omegapediatrics.com. They have a ton of resources there and seem ready to partner with families. Again, that's omegapediatrics.com.
Thanks for tuning into this discussion on pediatric care.
Yeah, we really hope this helps you feel more informed, maybe a bit more confident as you make these important healthcare choices for your family. Until next time on Have More Babies, stay curious and keep learning.